Hi, today we will read about atelectasis. Atelectasis refers to closure or collapse of alveoli. Atelectasis may be acute or chronic. Acute atelectasis, which occur frequently in the postoperative settings or in people who are in immobilized and have the shallow monotonous breathing pattern. Excess secretions or mucus plugs may also cause obstruction of airflow and result in atelectasis. Atelectasis also is observed in patients with a chronic airway obstruction that impedes or blocks airflow to an area of the lung. Pathophysiology. Atelectasis occur as a result of reduced alveolar ventilation or any type of blockage that impedes the passage of air to and from the alveoli that normally receive air through the bronchi and network of airways. The trapped alveolar air becomes absorbed into the bloodstream, but outside air cannot replace the absorbed air because of blockage. As a result, the isolated portion of the lung becomes airless and the alveoli collapse. Causes: altered breathing pattern, retained secretions, pain, alterations in small airway function, prolonged supine position, increased abdominal pressure, reduced lung volumes due to musculoskeletal or neurologic disorders, specific surgical procedures, example upper abdominal, thoracic or open heart surgery. Compression of the lung tissues may also cause collapse of or obstruction of the airways, which leads to atelectasis. Also, pleural effusion, hemothorax and pneumothorax causes atelectasis. Signs and symptoms: cough, sputum production, low grade fever, marked respiratory distress, dyspnea, tachycardia, tachypnea, pleural pain, central cyanosis, that is a bluish skin hue, that is a late sign of hypoxemia. Patient characteristically has difficulty breathing in the supine position and he is anxious. Assessment and diagnostic findings. In auscultation, we can find decreased breath sounds and crackles are heard over the affected area. X-ray finding shows reveal patchy infiltrates or consolidated areas. In pulse oximetry, we can find the SpO2 below 90%. Prevention: frequent turning and early mobilization of the bedridden patient and postoperative patients to expand the lungs and to manage secretions. Then deep breathing exercises, that is to be taken every 2 hours. And incentive spirometry or ventilatory deep breathing. And secretion management techniques may include directed cough, suctioning, aerosol nebulizer treatments followed by chest physiotherapy, that is postural drainage and chest percussion. Management, that goal is to improve ventilation and to remove secretions. So it includes frequent turning, early ambulation, deep breathing exercises, incentive spirometry, coughing, chest percussion, postural therapy, and ventilation by positive expiratory pressure therapy or continuous or intermittent positive pressure breathing. Endotracheal intubation and mechanical ventilation may be necessary in severe cases. If respiratory care measures fail to remove the obstruction, a bronchoscopy is performed. With a large pleural effusion that is compressing lung tissue and causing alveolar collapse, the treatment may include thoracentesis, that is removal of fluid by needle aspiration or insertion of chest tubes. These measures are to increase the lung expansion. Thank you.